story time on how my patient's doctor totally missed the diagnosis, even though it was right in front of him, and caused unnecessary testing, procedures, and a lot of wasted time and money. Now, this video is not to shame that doctor. Obviously, none of us are perfect. I've definitely missed things before too, but it's more so to send out the message that as physicians, we need to be looking at the entire person. And this is a problem when it comes to specialties. As a specialist, you're very much pigeonholed and zoomed in on your specialty, and that's when you can fail to see the entire person and it's in their entirety. And you end up missing the forest for the trees. And that's exactly what happened in this scenario. So this patient, she's a 32-year-old female who's been experiencing dysphagia, which is difficulty swallowing, right? And so first, her primary care put her on an antacid, thinking it was heartburn or reflux. And that didn't work. So then she sent her to a gastroenterologist to get scoped to see if there was anything there that was causing that dysphagia. So immediately the GI just scheduled the endoscopy, didn't really do a full exam on her. Now at this time she was also experiencing things like weight gain and some constipation. So they did check her thyroid just to make sure that was okay. They checked TSH, that's all. They didn't check a full thyroid panel, and it came back fine. So they kind of moved on to the endoscopy. They go ahead and they do the endoscopy and it comes back unremarkable. Maybe some slight gastritis, esophagitis, but nothing that would explain the difficulty swallowing. Boom. So she comes to see me because she's still having this. It's been a year. And immediately upon looking at her, she has an enlarged thyroid. Her thyroid is so enlarged and swollen, like you can't miss it. And I asked her, I was like, how long has your thyroid been enlarged? And she looked at me like I was crazy. She's like, what are you talking? What's a thyroid? I was like, oh no. I was like, has a doctor ever like palpated your neck or taken a look in this general region? She's like, no. How as a doctor are you not looking at someone's neck when they're having difficulty swallowing? So sure enough, I ordered a full thyroid panel. I ordered an ultrasound and it comes back. She has goiter, enlarged thyroid. She has iodine deficiency, and her T3 and T4 are completely out of range, even though her TSH was still normal, which can happen. So I basically sent her off to endocrinology. They get her squared away and she's doing so much better now. So please just look at the entire picture. Don't just focus on your specialty, because obviously not every patient fits into that box or into whatever specialty that you're working with. Thank you.